that the world is moving into technology, and we want everyone, both in Nigeria and out of the world and out of Nigeria, to be able to use their smartphones, their technology, to be able to access and improve their healthcare. And that's what we're doing with the Digital Mom project that is funded by MSD, and MDoc is a major key player in this. These are the ones bringing this session to you, and the session is primarily for every one of us, to everyone you that are women of reproductive age, you are a digital mom if you have a technological device. And that is essentially what this project is about. So we are trying to give you support in every possible way to be able to achieve maximum healthcare, survive through pregnancy and through every stage of your life without having to actively engage with the hospital because of sicknesses, of illnesses, right? So thank you very much for joining once again. Please encourage others to join. And while we are on that, we'll just also tell us a bit about MDoc, what we do at MDoc, why we are setting this up, and what exactly we have for you to benefit from MDoc. But like I said, the project is actively funded by MDoc Healthcare, and also MSD are actively carrying out this project. And what is it about? To improve clinical self-care outcomes for women of reproductive age, majorly in Lagos and Ekiti. So it's just for you to be able to ensure that your BMI is under control, your blood pressure, your blood sugar level, everything is under control, and that you can actively live your life and ensure that both physically but emotionally, in terms of mental health, which is one major neglected area, and also financial well-being, that we're helping you and walking you through every part of the way, and also using our AI chatbot where you can have virtual support. You can, even when you cannot speak to your health coach in the middle of the night, you can get answers to health questions, you can get health tips, you can get medical advice from our platforms, and also using this platform to build a learning network, and also to ensure that through which you'll be learning from the speaker today how we have built that review system to ensure that the care you receive even at these facilities is centered to you and personalized to you. So thank you very much for joining again. And okay, we have more people on the call now, so we will be moving on to the MDoc specifically. Like I said, tell you about what MDoc is. But before I go on that agenda today, after these welcomes and introductions, we're going to have a short pre-quiz, and we please encourage that everyone take part of this quiz. It is not an examination, right? And so you just answer that to the best of your knowledge. Then we'll have our subject matter expert coming to speak to us. Then after that, we're going to have an elaborate discussion and question and answer session where you can ask all your questions. Then, like we did for pre-quiz, we have a short post-quiz as well. Then the reaction survey to know how exactly we did, and we just wrap it up. And we can see that the timing, we want to be as fast as possible. Within 1 hour, 30 minutes, we're done. So what is MDoc about essentially is, like I said, it's a...
Hi, Daniel, can you hear us?
Yes, I can hear you.
Okay, so I think we could pause for a second. We do have people joining from other facilities. So we want to confirm before we go ahead, because we don't want anyone left out. So we'd like to confirm if the Lagos facility is connected. Praise, can you confirm that the Lagos facility is connected? And we have the Ekiti team as well at the facility. Kende, can you confirm that you are connected to the session? And you can hear...
Yes, we are connected. Yes, we are connected.
Okay, great. Thank you, Akinwale. Praise, any confirmation from your end? We just want to make sure that members that are within the facilities can hear us.
Yes, the Lagos facility is connected.
Okay, wonderful. Thank you, everyone. And for those joining on YouTube, welcome. I believe the facilities are joining us from YouTube. Please feel free to send in your questions during this session. Daniel, please speak to the project as well as MDoc so that everyone who has joined the session can be carried along. Thank you all.
Okay, thank you, Adora, for that. Like I said, the Digital Mom Project is all about enabling women to be digitally empowered, to be able to use technology, their digital tools to ensure that they have maximum care, and also they can live a healthier and happier life in that sense for women of reproductive age in most, especially Lagos and Ekiti states, and it is funded by the Lagos state government, MSD, and also partnership with MDOC. We are carrying out this project as well. And thank you to everyone who joined from YouTube as well. We see you, we hear you, and we also are welcoming you to this session. So, like I said, these are the primary drivers that helps us to achieve this. And also moving to the next slide, we have the agenda, like I said, for those just joining. After the welcomes and introductions, we would have a pre-quiz, then we move to the subject matter experts discussions and the post-quiz. Moving on from that, we would be moving to what MDoc is about. We are a digital health company that helps you to manage your healthcare and also ensure that you receive virtual care and in-person care through a popular approach. We have a complete health hub that is AI powered, and also where you can track your health metrics. You can speak to a health coach and also be a part of one of our programs. And also for our MDoc Quality Network is a platform where we drive learnings and education among healthcare workers, and also programs like this for women of reproductive age, where we're emphasizing learning and also encouraging people to also bridging that knowledge gap among healthcare workers, and as well our notch hubs where you can access in-person facilities. You can speak to a health coach in our notch hubs to or get health advice, and also tele-education sessions. You can be connected to speak to a doctor. You can check your blood pressure, your blood glucose, get health advices, and also moving on from that. So we will be moving straight to the pre-quiz now. So, like I said, we also this session will be recorded. So, for the sake of so that we can share the resources and others that did not join can benefit, and also for quality assurance purposes to know how well we're doing, we are recording this session. Also, just a few tips for everyone joining: please have your cameras on so as to ensure that it's as engaging as possible. And also, we would share the session slides and all the materials for you after via email. And please, if you want to speak, please use the raise hand feature in Zoom when you want to speak, and the facilitators will unmute you to speak. Or please use the chat function when you are not being asked to speak, and try as much as possible, because we have a wide audience, we have an international audience, to respect everyone's opinion, and we'll be here to provide every support along the way that you need. Thank you very much, everyone. And just to reiterate that, so moving on, we will be launching a pre-quiz very soon. So you will see on your screen a pre-quiz will come up. Please know that there are about 8 questions, so don't be in a hurry to submit. Just you will see it now on your screen. So just tick which of the responses you think is the most correct option. Like we said, there are no right answers or wrong answers. We just want to know how well you are aware of this before now. So there's question 1, question 2, question 3. So just tick one of them, and also when you are done, just end the quiz. So if you're having any issues with the quiz, taking the quiz, please let us know in the chat. Or if the quiz has not come up for you in your location, please let us know. Yes, thank you. You can also use that opportunity after now to put in the chat where you're joining from, your name and what you do, and where you're joining from, just to make the session as interactive as possible. So the quiz is up now. Please take your time to take the 8 questions. Just tick one of the options A to D and submit when you're done. So we'll have about 3 more minutes for this, and we will be moving to the presentation by the speaker. Please also remember to remind your colleagues, your friends, your family that you have shared the link before with now, whether to join us on Zoom here, or also to join us on YouTube. We are streaming live also from our facilities in Lagos and Ekiti. So we encourage you to send the link to your colleagues, your friends to join as well. So I believe we are making progress with the survey. So it's just a pre-quiz for you, just to get your knowledge about the topic that we'll be discussing today. Like we said earlier, centered around empowering women's voices. Okay, thank you very much. Please take your time to respond. Okay, please, we're still expecting more responses from the pre-quiz. Please, if you have any issues with taking the quiz, let us know in the chat. So we are giving a few more minutes for you to finish. Like I said, there are 8 questions. Please take your time to answer all the questions before moving on. Yes, thank you. Thank you. We're still expecting more responses. We are still expecting more responses. Okay, thank you. Thank you. We see your responses. Please continue to send in your responses to the pre-quiz that has been launched. Please, if you're having any issues, let us know in the chat and we'll be on hand to provide technical support. So once again, thank you all for joining from our Zoom platform here, and also those joining from YouTube and those joining from the facility live. We have people joining live from a facility today from Lagos and Ekiti. Okay, so we have 1 more minute to complete the pre-quiz. Then we'll be moving on to the subject matter expert profile for this conversation, and we'll go into the presentation proper. Please ensure that you Okay, so we are still, thank you very much for taking the quiz. Oh, Sarah is joining from Port Harcourt. Thank you so much for joining, Sarah. Please put in the chat also where you're joining from. Okay, so we'll just give 1 or 2 more minutes to complete the quiz. We're still expecting a few more responses. Please send in your response to the poll. Yes, like I said, it doesn't have to be a correct response. If you don't know it, it's okay to just go with the one that you feel is the most correct option. Okay, Abdullah is joining from Kaduna. Thank you very much, Abdullah, for joining us today. Okay, so we have people joining from Health PHC, Gondo, Lagos State here. Thank you everyone for joining. So please take the quiz as quick as possible. We'll be closing the quiz right now.
Praise and Akinwale, can you kindly confirm that you're able to access the quiz and our members within the facilities are engaging on this? Can you kindly confirm?
Yes, it's live and direct. Yeah, already distributed the quiz. So it's also shared by so they're already working on it. So live and direct, that was going on.
Thank you, Akinwale. Praise, can you confirm, please? And has this been posted on YouTube as well? We have people joining from YouTube. We will kindly like to ensure that everyone is carried along. So the quiz, the link to the quiz will be posted on YouTube as well so that you can fill out the questions. Can we get a confirmation from the facility in Lagos? Praise, can you hear us? Thank you to everyone who has submitted. For those who are joining on Zoom, please feel free to fill out the quiz. If you are not able to see it on your screen, just go to your settings where you have chats. Beside chats, you would see polls/quizzes. If you click on it, it will show up on your screen. There are only 8 questions, straight to the point. We just want to know what you know. Nobody's going to be scoring you. We just want to know what you know. And we'll go into the session and continue to build your knowledge. Can we get a confirmation from LEF PHC Gondo? Please go ahead, Daniel, over to you.
Thank you very much, Adora, for that. While we're still waiting for confirmation from the facilities, we hope that you have gotten a chance to take the quiz. Please, we'll be putting down the quiz, live quiz, down shortly. So please, if you have not taken the quiz, please take a minute to complete it. Like Adora emphasized, there's no pressure to answer the questions correctly. We just want to know where you are in terms of knowledge about this. So if you are having any issues, you can just click the settings button and you'll see the pre-quiz and you can easily just complete the quiz. Like we said, it's 8 questions and you should be able to complete it in less than 2 minutes. So please take 2 minutes of your time to complete the quiz. Okay, so we will close the quiz at 10:29 so that we're just giving room for everybody to complete the quiz. So we'll close it at 10:29 while we wait for others to complete the quiz as well. Like we said, there's no pressure to get the correct responses. Just want to sample your opinion on some of the key discussion points in the session. Okay, 1 more minute to complete the quiz. We'll just give 1 more minute before we close the quiz. Thank you to everyone who has participated so far. We appreciate it. And we're just waiting for the few people and across all our locations to as well complete the quiz. Okay, welcome, Olayinka from Isheri. You've completed the quiz as well. So we'll be closing the quiz in few more seconds. Yes, and we will be closing the quiz now. Thank you, everyone, for participating in the quiz. So we will be moving straight to the presentation, and the subject matter expert is somebody that I believe is in the best position to have this conversation because of the work he does. He is a most importantly, first of a project manager, and is somebody that has worked around working with getting people's feedback and ensuring that the quality of service is consistent across multiple facilities. Is an IT and digital health project manager of over a decade experience leveraging innovative technologies to drive transformative outcomes, and is an expert in digital health space, AI, product development, business education, and data protection. And he has delivered impactful projects in Nigeria and in other low and medium income countries. So he's an human capital development advocate, and he has also led collaborations across different teams and disciplines to involving research, clinical data, ML teams, and also ensuring that the strategic and project leadership on digital health projects both in Nigeria and across, and also ensuring that there are initiatives to strengthen health systems. And his work is also centered around NaviHealth, which we'll be hearing a lot about, and how we're using NaviHealth at MDoc, and how he's championing that to ensure that we're getting quality care in our facilities. So he currently leads the NaviHealth team at MDoc, and also is the data protection officer at MDoc. And I want to see in the chat applause, because he's somebody that I respect very much, and I'm definitely sure we're going to be learning a lot from. Can we just put our chat, our reactions as we welcome our speaker, Solomon Chinedu? Yes, please put your welcomes in the chat, and I'll be handing over to the speaker now. Over to you, Mr. Solomon. Welcome.
Thank you so much, Daniel. Thank you. Please confirm you can hear me clearly.
Yes, we can hear you.
Okay, thank you so much, Akinwale. And let me start by first applauding our partner facilities where we are currently. We currently have women who are joining us. Big shout out to both the MOH, the OIC, and the leadership team at Ikotun PHC in Igondo, Lagos. Thank you so much for ensuring that you are part of our partners in what we're doing, and ensuring that women are able to join this session today, and also learn from what we're about to share. Also, we want to sincerely appreciate Okeyemi PHC in Ekiti. Thank you to the facility leadership, the OIC, for also providing the facility to enable women to join this particular session. Okay, welcome everyone, and thank you for joining this very important teleeducation session. Today we will explore a topic at the intersection of gender equity, health system improvement, and participatory governance. Given that this session is supposed to be very interactive, I'm going to ensure that I carry everyone along in whatever I'm sharing. Please, I would advise or encourage us to use the chat area, drop your questions as we go along. For those of us who are joining live from Ikotun PHC and Okeyemi PHC in Ekiti State, please, you can pass your questions to our team members who are there on ground to support you. This session is titled Your Voice Counts, and it is very, very important. And we chose this topic because it reflects the undeniable power of women's feedback and participation in transforming health systems. So this is not just about advocacy or maybe representation. It's how we ensure that the women, the same way they are currently at the facility, are ensuring that their voices count, so that the next time they visit any facility where they receive care, they're able to see practical or realistic changes that have happened as a result of their voices being integrated in the quality of care that they have received. Next slide, please. Okay, I want to start with this very important quote, very important. Kofi Annan. Kofi Annan is the former UN Secretary General, the first from Africa. He said, there is no tool for development that is more effective than the empowerment of women. You're going to hear me mention women, women, women. Then oftentimes there's usually this question, especially from male folks, saying, women, 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 what about men? Let me also quote something in MDOC's head office in Lagos. When you walk in, there's a very powerful quote on one of the walls that says, when you educate a man, you have educated an individual. But when you educate a woman, you have educated a family, and by extension, a nation, because families are microcosms of a nation. When you have multiple families, or multiple families essentially make up nations. So the focus of this session is just to see how we can empower our women to lend their voice, given the critical role that they play. Okay, for those of us who are religious, we understand that we get to hear this a lot, that women are the only other beings that have the capacity to make life beyond God. Women are the only other people who have the capacity to make life. Given how very important these women are, we want to show how their voices are very, very integral to improving the health system that we have around us. So in this very short, brief presentation, we'll look at the impact, how women's voices and agency are very important for improving health systems. We'll look at some of the data that can help us see what has been the barrier, stumbling block for ensuring that women are effectively participating in the system. And we're going to see some of the ways, tools that women in the society can take advantage of in providing or voicing their opinions in the health system so as to drive changes. And then we can also see the direct impact, some of the examples that we have seen. And then we can wrap up the session. Like I said, please drop your questions in the chat. I'm very eager to see them and see how we can have a very meaningful conversation. Next slide, please. Okay, well, we'll start with very simple definitions. Okay, number one, what is voice? Let's just define these core concepts, because some of us, when we saw the invite.
Hi, Solomon. I'm sorry to interrupt. We do need you to kind of break these things down, because there is some feedback that the women aren't really grasping some of the words. So you might want to break this down to make it more relatable. Thank you. Okay.
Thank you so much. Thank you so much, Adora, for that very important feedback. I will do all my best to see that this is well broken down. Okay, so let's start with voice. Okay, we know what voice means. Voice, every one of us, we all have voices. As a human being, you have a voice. But voice in this context is your ability to express your needs. Okay, so I need something. I've gone to a facility and I need to have a good place where I can sit down when I get to that facility. My ability to open my mouth and say it, or to use any other means to communicate what I'm saying or what I need, that is what we call voice. Okay, so within the healthcare system, voice means your ability to give feedback. Feedback is, you know, when you go to, maybe you are in a place where someone says, can you hear me? And you say, yes, I can hear you. You're giving me feedback, okay? In this sense, I want to be able to understand that you are able to hear whatever I'm trying to pass across to you. So that's why I'm seeking that confirmation from you. Can you hear me? You say yes. Within the healthcare system, having a voice says, you can tell the facility, you can give them feedback, you can tell them where it matters to you, what is most important to you, whichever way you are feeling. So for every day you go to a facility, you must understand that you have a voice, okay? And like I said, a voice is your ability to express your needs, your concerns, okay? Whatever is disturbing you, just say it. Whatever you like, say it. Being able to say it, ask questions, complain, that is voice. Now, agency, on the other hand, is your own ability as a person without the influence, without anybody telling you, oh yeah, talk, or yeah, say something, or yeah, do this. You have that ability on your own, okay, to make a decision, to decide, to say, okay, today I am going to this place. Today, when I go here, I'm going to say this. No one is forcing you. No one is influencing you. It is your own choice, your own ability without the influence of anybody to be able to take a decision, either with regards to providing feedback, asking questions, choosing where to go to provide, to receive care, okay? And then anything regarding your health, okay? Having that autonomous, we'll call it autonomous. Autonomous means no one is influencing you. You have that capacity to make a decision on your own without any influence from anybody. Then empowerment is when you now combine voice and agency, okay? So we're saying empowerment is where women now have the power. You women who visit healthcare facilities, you have the power and confidence to ensure that things change in your environment, okay? Things are able to change in your environment because you are able to influence or make things to change. So you have been able to gain that power and the confidence. So you know that any day you stand up and go to a facility, it means that you can go there, by what you say, things can change. So if you go to a facility and you see that the facility is not clean, okay, the primary health center, the hospital is not clean, you can go there and say, no, I don't like this. Please, I want this to change. And so that the next time you go, you can see such improvement. Let's go to the next slide. Okay, these are some of the data that we can see when it has to do with how much representation women have. You know, before now, and this is a serious issue, thank God that today everyone is saying, let's give women a chance. Let's give women a chance. Let's give women a chance. Because we have seen that not just in Nigeria, but everywhere, okay, many women don't understand the power that they have. They do not understand the power that they have. They do not understand the opportunity that they also have. Some of the data that we see, I'm going to break them down. Number one, 70% of healthcare workers, like most of you who go to the facility, those of us who have gone to the facility, some of the healthcare workers you see, okay, most of them are not women, okay? Or rather, why 70% of them are women, only 25% hold leadership roles. What that means is, now let me even break it down. When I go most of these healthcare facilities, when I see, and I go discover, say, anywhere where you enter, that's also women. But despite that fact, most of the women there, not be them they in charge. Even though say we sabi say women get the capacity to change a lot of things. Then the second data, 47% say for Nigeria, women were there between 15 years and 49 years old. Most of them don't know say they get the capacity to change things within the facility. So that one said no problem. And then another data, what would they see? The one to the left, 1 in 3. It said for every 3 women where you see for any healthcare facility, or where you see where go any of the healthcare facility, most of them know they like waiting that they see for that facility. So it's a problem. Now, if most women, they see these issues, it therefore means that if we really want to make changes happen within those facilities, women should be able to talk. Okay? So as soon as they enter facility, and they see issues there, if women know they talk, then there's a problem. So if we want really see changes within our healthcare facility, see improvements anywhere where we go, then women need to understand, say, they get the power and they're supposed to be talk. Then the last one, say, countries, about over 90%, 90 countries currently now, they gather citizen feedback. Okay, they get ways whereby they allow make people they talk, they give them feedback. The only problem, I say, most of these feedback systems, most of these ways where people provide feedback, most of them know they recognize gender. They know they do favor women. Okay, for the next couple of slides, I go show some data where will sort of make you understand what they try to. Now, but before we go into the data, maybe we see something, some other information that will help us understand what we try to talk about. WHO, now World Health Organization. But what do you mean? I say the organization where for the entire world, where they're responsible for ensuring that we achieve good health for all countries of the world. Then they try. Now, WHO emphasize, say, if you want to see good outcome, if you want to get better care, if you want get a good system where we say anytime we go healthcare facility, you go get the best possible care. WHO say getting good care not just depend on say you go to that facility and you get the right treatment every time. But one thing where they're very important, I say anytime when you go to those facilities, they get care where they're respectful, they get care where they're informed, and they get care where they're supported. For instance, we don't get cases where we say some women complain, say they go healthcare facilities, pregnant women. We know some facilities, they do those kind of things. Okay, but we say even some of the nurses self, when you go there as a pregnant woman, they feel even they slap you, they feel talk to you anyhow. They just when they get frustrated, all of us are human beings. So out of frustration, they feel talk to you anyhow. Okay, but waiting WHO they talk, they say for care to be very good, then it must be respectful. So every time when you visit a facility, when you go there, you dare confident say any healthcare worker where they follow you talk, anybody where they give you any sort of treatment, anybody where they attend to you, they do them in a compassionate way, in a respectful way. So now when you self come out there, your dignity is intact. Number 2 now, communication. Okay, where we say anytime when you did that healthcare facility and you a doctor that attend to you or a nurse that attend to you, there's that clear communication. You understand what thing they happen. You dey fit ask question and they answer you. Then number 3, every decision about your health that you will take care of, and nobody will force you. That's what now what we mean by autonomy. So now you get the right as a woman to decide the kind of care we you receive. And the last one is supportive care. Okay, care will be say they touch body. I don't know how to take talk for pidgin, but care will be say they're very supportive. Okay, some of us don't experience that. Maybe say when a healthcare worker or a nurse, a doctor, they attend to you, you self know this one really get your time. This one come to your level and it meet you where you did. Next slide. Now this slide also shows some of the data what they see. Make una understand say this is what they talk about women speaking up in the system so that the care one and they receive one at go healthcare facility can be better. Not be just Nigeria. Okay, we do some research. Okay, we see say many African countries, about 7 of them, okay, get systems where they allow women to provide feedback. What do you mean? We say anytime when you go to hospital, you go for ANC, you go for immunization, anything where can you go any healthcare facility. When you reach there, before you come out from that facility, from that hospital, you get something where they don't put there where will help you. Tell them how you feel that particular day. If I say you want to tell them, when I try today, when I try for this one, you go fit tell them. If I to tell them, say, when I don't try for this one, so the next time I will come back here, I won't see changes. Then you can also get a way where you say you go fit give them that feedback. When no go, when they're very easy. Okay. For instance, in Tanzania, another African country. Tanzania, they say when women begin, they give feedback using scorecards. Scorecard they like paper. Okay, scorecard they like paper. Where you say when you come there, you go carry paper, write certain things. Say, for today, for cleanliness on our facility, they clean. You go write your score, the score where you go give them. If not, say how well they treat you, you go score them. Then see say when women begin, they use that paper, they score the hospital where they visit. Then see say improvement on day. Because as you they give the facility the feedback, as you they tell them your mind, the facility too, they use what you tell them, take improve on their service. Okay. Now, somebody goes, okay, with that paper thing makes sense. But some of us will only say, if we use paper, how many of us get pen? Okay. And then some of these things, some of you they say, if I use paper, I can't write with my hand. They go see they use hand right. If they monitor me, some of us they fear. Like this slide they show now, they define, okay, waiting they cost when they say when women go hospital, they know they fit tell the facility their mind, they know they fit talk as they do them. Okay, we ask some of our questions when we see for some health facilities in Lagos, and we see number one, fear. Some women they fear, and we understand. We understand. That's why we get this type of session, so that we go fit, put your mind at ease, teach you how and why it is important. Saying that when you go healthcare facility, they always talk, because these healthcare workers they get busy. Sometimes they don't even know how they do now. They don't know how they do now. So they want they sure say they really understand where they touch now, so that they go fit provide that feedback. Okay. Number two, we see say, maybe the society where we did, for Nigeria, for instance, for some states, we see say most people don't get that orientation, say they actually feel talk. They don't understand. You get me? Okay. Then another one, I say, for the facility where you visit, some of them don't even get, they don't get how you go fit to provide that feedback. Say the healthcare workers, they're busy, the nurses, the doctors, so many people to attend to. So they don't get time to come stay with you, make you, they tell them how they do you. And you said the one rush go somewhere. So sometimes, because they don't get means where we say you go fit provide that feedback. Now, another thing where they discourage women from providing feedback. And some of them, they fear. If I complain now and say, this facility don't do well, the nurses go come, they attack me. But no be so, okay? But we understand that some of them, they get that fear. So if I talk, say the 13, when I go next time, they will say, now that woman, I say with 13, then they will begin to fire me. But you're not supposed to be like that, because these healthcare facilities, they won't make you talk, because now waiting you talk now will help them to improve. Then we also know, say, for Nigeria, you know, and the funny thing I say, women, we know some women are big talk, and I they talk, I mean it in a good way. Women, men, sometimes women, they try with the life what to they'll say, be a man, no talk. So I like that thing about women. When they do them, they will tell you. But we discover, say, when they come go hospital, where they're supposed to talk, they don't come to talk. Okay, for when we start Project Aisha na one project what we do for Lagos and Kaduna State. Okay, and that project they go now to reduce maternal, waiting the cost when they die, when they give birth, to reduce them by about 20%. And they try already. But when we start the project, one key thing we want to be say, we want to ensure say, waiting they help us help the women. I say the women they talk. So when you come facility today, you go tell them waiting, you know, like by the time when you visit, you go come check whether they don't do what you tell them. That way, you see, say now women are they drive improvement in the healthcare system. And we see say all of this, and then people they fear, they don't believe say they get any good feedback, any platform, any system where we say the fee take use, they provide all the feedback where they need to provide. But we'll go next slide, please. So this, the picture now make us just talk about some of the different ways where women provide feedback. Where tell hospital your mind. So at the next time when you come, you will see improvement. Like I mentioned, for countries like Ethiopia, Uganda, Malawi, they don't do that paper or where you use pen and paper. But we know that some of them don't even get time. Because say when I want to carry pen and paper, begin the write, you know, and if it's stressful. And when you even write with paper and pen, okay, if you had the facility, the hospital now, to come and read plenty paper, but say 1,000 women talk their mind when they want to finish, understand what to write on the paper. Then another one for Nepal and India, other countries, I don't hear about Nepal, India. That one I say they go gather some women from time to time. Then each one, they go ask each person, I talk, you talk, you talk. But the problem I say, how many people they figure that? They figure out 1,000 people where go maybe they got to PhD now. They don't figure out 1,000 people. But now some of the systems where they work. Then for Kenya, they get that feedback box. Feedback, when I go see a complaint, drop your complaint, suggestion, or if you write paper. But some of them I feel able to remember, carry paper, carry pen, and you said feed the fear. If I won't go drop that paper now, they go mark my face. You know, so but it will work for places like Kenya. Now for Nigeria, it get one system where we don't see, now be NaviHealth.ai. And we didn't talk this one because we don't, most of the facilities we don't join today, like KME, PSC, for Ekiti. We even see so many other facilities from Kaduna, from Lagos, both Ekotun, PSC. Most of them already use them and they work. And we will share some sharp examples before we end this session. But NaviHealth.ai, now a feedback platform. Once you get phone, now that is all you need. Once you get phone, it will be very easy for you to provide feedback. But we'll go next slide. Okay, so waiting be NaviHealth. Actually, they see the screen so because most of them when I enter and go to these facilities now they hear NaviHealth. NaviHealth now a platform, okay, for internet. Where we say, make I give an example. Maybe I define dentist now doctor where they have if person teeth the warrior. I define dentist. I don't know where the dentist did. I know they shop. And I know that time they will come begin asking because you know how we do for Nigeria. You go ask person question, he go tell you, if he tell you the one way go even confuse you. I no go cuckoo stress. I go just go NaviHealth.ai. I go type dentist. I go put my location where I did. I did Shagamu, I put them there. I go hit enter. It go come show me all the facilities. Okay? It go show me all the dentists where they are around me. And I quickly go. Now, but the important thing about NaviHealth.ai, NaviHealth, so anytime when you go any facility now, ask them, I beg, I want to tell you now my mind, when I get NaviHealth.ai. NaviHealth.ai can't get a way where we say women feel provide feedback. Okay, they're very simple. Go next slide. Make a quick, they go rush this thing because we know we get that. We know something of like get many places where I go. One thing about NaviHealth.ai, the feedback platform, let's say, it go help the facility understand what you they talk. If you get a lot of things to say. So when you go NaviHealth.ai, it will allow you, make you filter the facility, say, for time, when they keep the time, or when they waste my time. Okay? If you filter the facility, or whether your healthcare workers they try well, when they try or when they try effectively, different dimensions. And then apart from the one where you're supposed to click, it will even show you a box where you say if you type everything as they do you for mine, you go type. The idea I say make you feel easily. And this one I say you feel do one on your own. Okay? If you need help, you can ask any of the people within the hospital, may they help you. So far, so good. We don't get over 50,000 hospitals where they NaviHealth. And we don't collect over 22,000 reviews. That's because you say many people they use them. Okay? And over 140,000 people, including women like you, them don't use NaviHealth. Find the nearest facility where they close to them. We'll go to the next slide. So if you want to tell a facility now how they do you, it gets 6 questions. So if you go www.navihealth.ai, but those of now when they cartoon PSC now, and if you ask them, well on a QR code, now wait if you open your phone, once you scan them, it will take you straight to a cartoon PSC or KME PSC. You will see their profile. Some of our team members they will guide you. The way they try to talk now, I say, anytime when you go to that facility, always tell them how you feel. If their seat no good, you tell them. If not shout for you, you tell them. If so, not be only when it's good or when it's bad. Or not be only when it's bad, you go tell them how they do well. Okay, so you go tell them both when they do you good and when they do you bad. Why? If you tell them when they do you good, when you tell them what they do good, so that they will continue to do one. Don't be say they don't do good thing today. By the time you go tomorrow, they don't scatter. Okay? So may they continue to do good. Then the one where they don't do well, then you also tell them so that they go fit there. If you get any question, they're gonna tell. If you call any of our people they with now for that healthcare facility, tell them you can ask your question. But those of you joining online, they can also type for inside the chat box. So to provide our feedback, you will tell them whether the treatment what they give you, is it safe? Was it timely? Not so that you go out to 3 hours, you still stay there. You know good now because you said go other place where you go. So if you tell them, say, they not try today for time. If you get anything where they feed to, they go do it. But when you go, about 30 minutes, you don't finish. Effectiveness, whether the doctor really treats you well. Don't be say you go out to go complain for headache, as they come out, the headache can't double. We don't want that kind of thing. So you need to give them that same feedback. Then patient-centered care. That one to know whether the way they attend to you, whether not the way you want. Because now so it's supposed to be the way you want. That's so they're supposed to provide that care. And then privacy. Hope say everybody for hospital know hear what thing they do you. No. So if for any reason doctor attend to you, but different people just enter, everybody whether they call and gossip, people won't know it. It's not supposed to be like that. By the National Academy of Medicine, they thought say if doctor attend to you, only you and doctor supposed to know what thing they happen for them. And then equity. So nobody will say, because say you talk, because say you short, because say you big, because say you no big, we don't go attend to you. You don't want that kind of thing. So now these 6 things, and if you go NaviHealth now, you go see say it is very simple because emojis they there where you go click. So if it's good, you go see one smiley face, go click on. If you know good, you go see the one where the person front, you go also click on. Now, the data what they show now, for those of now where they see now example of women where they give feedback. We don't collect over 22,000 reviews, but you don't see them now say over 15,000 now from women. Now from women like you, okay? And this now from between 2018 and July 2025, okay? Between January 2018 and July 2025. We don't get many reviews from Lagos, from Kaduna, from Ekiti, from Abuja, and from other countries, as we see the map, from Ogun, from Anambra, from Sokoto, from Bachi, different places, they provide feedback, okay? Very, very important. And then for the things we don't see, now this one is very important because like we talk, the reason why you tell them how they do it, now so that make the healthcare facility, make the hospital where you attend, make the use that information where you give them, improve the service. But wait first, before I continue, make I ask one very important question. How many of you don't go hospital or pharmacy or clinic where you don't like how they treat you? Raise your hand. Make I see whether they even understand what they talk. How many of you don't ever go hospital now, whether hospital or pharmacy or in fact I go one day before yesterday, one I don't like how they take. But make I know if those of now when they a cartoon place, make una raise my hand. My people can help me count. Those of now when they okay me place, raise now. Those of you joining on like YouTube, how many of you don't ever go hospital, pharmacy or clinic when we say when I don't like how they treat you now? Just raise your hand, make we see them. Make una confirm so that they raise your hand.
Three hands. 3 hands.
3 hands. Oh, okay. Very okay. Thank you. Help me take. Okay, no wahala. Thank you. So when we talk, I know that many people say, "Look, one raise hand, make it no be safe." But remember, so we don't tell us say hospital like make it. They tell them as they do, because they there to serve them. Because if you're not happy, you're not go tell others when they visit that facility. That's so. So you don't need to the fear. Okay, you don't need to the fear. I haven't seen some people even raise hand for here. Okay, like me, I thought a few days back, I go hospital, I people not like how did they do because our own too much. But we understand, say, even these healthcare workers, they try. But they no go know if you not tell them. They talk and they help. Get one adage where they say, "I picking where is her nine mama they tell you." But a person will talk and they get help. For the different things we don't do, digital mom project, you know, this teleeducation session, a digital mom project, nine the sponsor. So digital mom project and Pray Aisha, the over 15,000 women we don't give feedback. We do analysis. You know, the good thing about computer, I say. Some of the things where if you write for paper, where person no understand, when computer touch them, it go analyze them. So you feel maybe understand because not only you talk, 10 people talk, 20 people talk, 30 people talk. So NaviHealth.ai, our dashboard now will come analyze everything. Can't tell the hospital say because the hospital themselves they see this review. The content and say you see women don't like say. When I don't get plenty workers. Women don't like say when they delay them. Women don't like say on our staff they rude. Women don't like say on our staff, on our workers does it do anyhow, or maybe on our toilet they dirty or anything. They go be able to see it. So your own work now to understand say you as a woman, whether you Ekiti, whether you Lagos, whether you Kaduna, you get the power, okay, to go facility, talk your mind, and that facility. Go respect what you talk, they improve their service. Okay, Mark, we'll go next slide. Mark will finish. Okay, I want to share some very quick example of women like Fona will provide feedback. And the feedback, what they talk, can help improve facility. This one, we say we gave privacy, we know they share, but we not supposed to share. One woman, we go call her Mrs. D. She go one general hospital, call them and say, the mode of operation is poor and is not satisfying. She complained about their safe and no day, their ward, female ward, and say mosquito just they bite them everywhere. Say in fact, say she come hospital, come up with another sickness. You can imagine how disappointed the woman will be. Next slide. Now, when the facility see this review, what thing they do? You got what they call change idea. Change idea now. Okay, this person complain about this thing. Okay, what thing I go do to fix that thing where they complain about? Chicken out. And it is very simple. So person don't complain, say mosquito everywhere. Okay, and say as she come out the hospital, she can't carry another sickness. Say everywhere dirty. What in the hospital do? Sharp, sharp. They call their sanitation team. They clear all the ground. Like we talk, some of them they're too busy, so they don't even understand. Every day, morning to night, they work. So, but as a patient can't complain, woman can't complain, immediately they clear the grass. And if I wait till they come to and say, anybody now, if you go to that hospital now for a paramedical center, but if you go there now, anybody when they admit, they go give you mosquito net, where you go carry go house when they discharge. Another example we'll see, this one go the facility, the hospital come say, the facility is small. Okay, and when they come for immunization, space, no day, no chair, nothing. They complain. You know, imagine say you go hospital, you can't on the stand for waiting now, waiting the facility. Go the next slide. No, waiting the next slide. So what did the facility do? They not say to hire new staff not too easy, because some of the women don't say maybe because they don't get plenty hand. They don't say they don't be easily hired to hire no. So what did they do? Because okay, we go use scheduling. What be scheduling? Scheduling an appointment. So if your name now, if your name, your son name, your papa name or your husband name start from A to F, you can only come between 8 a.m. and 10 a.m. So when you go, only small women you go meet, because only on our way fall under that arrangement, only on our line go show up. So with that, they go attend to. So normally when you go, where you go see 100 women, 200 women. This time away you go only 20, and they go attend to all of them immediately. So now waiting they do. Ensure say people they come only within specific time. So because of that, now people know they wait again. Patients know they complain again. Everybody say, if you go to that facility, they plenty. And if for no day possible, if that woman no come complain, on they say I'm happy, we could go to the next slide. Another one, this one, now waiting the important for NaviHealth now say, if they give your review, you feel hide your name so nobody will see your name. But if you want make your name show, like we don't tell you, nobody will fight you, because the facility they beg say give us review. But if for any reason you can't go there and say I don't want to make anybody see my name, you get option. So as soon as they there, like those of now where they this a cartoon PAC, our team they now to help them, so that maybe they should guide you and show how I go fit one. So anytime when you go there on your own, you go to tell them how it they do you. This one now, no, not go to the previous slide. Previous slide, I beg. Let we see what the issue be before we see the problem. Would they control my slide? Go to the previous slide. Thank you. So this one said the hospital good though. The only thing I said, they don't get equipment for labor room. And the mini theater, no, they also don't get equipment. Imagine say you go after 9 months to go deliver, they don't get basic things where they will take. But we see saying that this now our reality for Nigeria. We the hope say things will improve. Okay. So when this woman talk, it really pained the hospital. Waiting there to go next slide. Immediately when the hospital see the woman talk, they go tell the medical director, we don't complain about this thing, no, on our talk. Now our people don't complain. So sometimes when I even complain, when I even help the healthcare worker, so that government, so that the people where they responsible for these things can provide it. And this will happen for Zaria or Kaduna State. Within 24 hours, when that woman talk that thing, when the facilities here, immediately they stop, because they understand that when women don't talk, they carry power. Okay, go next slide. I don't finish. But I also, so waiting with the try talk now and say, women una get the power to change things. Una the power they will hand, but only if una fit talk. If I remember someone say for you to talk, not only when they do bad though, if they do good, say today una try well done. Because as soon as they talk, they get ginger. They understand, say, even people they appreciate. You remember the times when we say you give your pikin food, your pikin say, Mommy, thank you. You said the guy they do you for. You they appreciate the thanks. Okay. So but when you use platform like NaviHealth.ai now, it ensures say don't be like feedback box where they hospital. When you feed us, if I put an ad, they go attack me. No, so you get a platform. So with NaviHealth now, it is very free. So as they give feedback, the facility they see them, they come up with change ideas. Remember, change ideas. Solution where they go take address the thing where you complain about. So with this now, you can freely give it. If you there in your house, you day anytime. If you go NaviHealth.ai immediately, come provide that feedback. Not we go the next time. So for government, we get advice, different advice for different people. Number one, we able to say, okay, make government now, maybe ensure say, maybe they encourage people. Well, we work with the Lagos state government, we work with Kaduna state government, so that they will continue to tell other people. But you now, we don't come, you don't hear these things now. Tell other people, say, and that way you go to this facility, ask them how far I won't give feedback. If they don't know about NaviHealth.ai, then tell them, okay? Then for the health facility, when I know say some like a cartoon PSC, we already partner with them. Okay, they partner with them, okay, they get NaviHealth and so many other facilities. So continue to encourage your people. Make them know say this review is important to you. So as they come, as they enter the facility, maybe they tell them before they come out, maybe they tell you how well they serve you. Okay, so this one is very important. So those of our way they ground, tell our people where they there, may they feel assist you. Okay, make you go NaviHealth.ai. I even may they show you how you go do it. You know, so we got another platform where they call Complete Health. They feel help you. Okay, show you how you go feel Complete Health. That one now, so that you go feel get support when you don't be in hospital. You also get support. If you go Play Store now, Google Play Store now, if you download Complete Health. Okay, inside that Complete Health, you get our AI chat what they call CARE. That one, if you chat that, they give you normal gist, guide you. If you ask them anything about your PP, about your food, about anything where they bother you or your picking or your neighbor, anybody. But until when they're there on ground now, can support you so that you can see how these things can hide if you work. But we'll go to the next slide. So what we don't get from this talk, why don't they talk for? And I think myself, I don't try. One, I say, it's important to talk. When you go hospital, it touch you for body, good or bad, tell the hospital. Make them know. Tell them how it bother you. Okay? Then ask them, I won't provide feedback, I won't tell them feedback. Ask them for NaviHealth.ai. Okay, if you need help, if you ask any of the healthcare workers, because we don't also teach them how they will teach you now how to also provide the feedback. And then, but just ensure, say, every time, when you tell other women, tell them, say, we women, we get enough power only if we open our mouth, take talk. And for facilities, when I don't say some of the examples, many of them are the try. Many of them are the try. Like in cartoon PSC, we don't see what are they use, what women they talk, they improve. Make una continue. And anytime we wanna do something where patient talk about, and I don't do it, make una tell them. Make una tell them. Maybe before they start here, say, last week or somebody complain about this, we don't fix them. This one, I complain about this, we don't want. I beg, continue to tell us how we go serve it. And at the end of the day, I have to make a pause for here. Thank you so much. If we get questions, make we begin ask the question so that we go fit. Question, make we dey see am, make it dey enter. Remember, we don't say not be only as they do you bad, now as they do you good too. Remember, if they do well, tell them, I don't go hospital. As they do bad, as they call, una they try, una things they fast, so that they go continue. Maybe they not know that they see them. But if it's bad, make una also tell them. And over.
Thank you so much, Solomon. Thank you for such an informative session. Thank you. I am not seeing any applauses in the chat yet. Can we please appreciate such an informative presentation, such important information that we have been given today? The key thing I picked up was that if I do not speak, there won't be change. So it is important that you speak. We encourage all the women to leave positive, negative reviews of the experiences that they have been receiving in these facilities. It is very, very important. I am not happy with the applauses. We don't want to upset our speaker. Please, can we get more applauses? But thank you so much. We'll be heading over to the second aspect of the session, which is questions and answers. So this is the burning aspect, the questions that you've been wanting to ask. People will be given opportunities to ask these questions. People from the facilities as well, at the two facilities, one in Lagos and Ekiti, will be able to ask those questions. So the first question that we do have here, and excuse me if I put on. Okay, go ahead, Akinwale.
Right.
Okay, I asked that. Is it only health issue that we can give feedback, or maybe domestic violence, or any other things?
She wants to know whether there are other things they can give feedback on. Is it only health? So I want the speaker to address that. Thank you.
Okay, make everybody ask. Thank you so much. Thank you for that very beautiful question. We figured out that question, so because of time, we will collect all the questions, make I answer all of them at once. Any other question? Thank you so much from Kemi, PhD, Ekiti. Any other question?
There's another question here.
Okay. Thank you, my Ekiti people.
Yeah, she's asking that is it only women, mothers, or is it every gender, every family member that can give feedback?
Nice one. Nice question. Nice question. Thank you. Our Lagos people, any question? And then those of us who they join online, maybe we drop our question too. Drop your question. Make we fit answer all of them at the time. Or if you don't want to talk, if you ask anybody when they're around, our team members say that if you tell them, they will help you. Okay, maybe I take the question. So if you go, maybe I take the first one, whether only health related issue. Okay, so waiting, so for NaviHealth, okay, NaviHealth.ai, the designers say to help the health worker, okay, to help the health worker understand waiting they worry you when you go that facility. So that the way you enter, the care way they give you, okay, how it is. Then do you well or then do you bad? Make you provide feedback, okay? Now, we know say there are other issues like domestic violence, and we pray make it stop, okay? So we get other hotlines where they NaviHealth.ai, okay? Hotlines where we say go fit reach out to the government agency, okay? Where they're responsible for this thing. Because to help this sort of matter, you also need people who go fit we get the capacity in terms of maybe police power or the rest of them to help you address this issue. So NaviHealth, now strictly for when you go the facility, when they don't attend to you, then you will tell them how they treat you. But if you get any other issue, like you mentioned domestic violence or any other safety issues, we get hotlines on NaviHealth. If you ask our team member, they'll make it show you how you will see the emergency hotlines. Where you will call anyone, when you call anyone, they will give you better support. Then also, if you get issue, because domestic violence today very tricky, if you get that, if you follow your healthcare work at all, okay? If you get your speak to your healthcare worker, make it for fit, provide you additional support. Then I really get small time. Then the platform now for everybody. Now for everybody. We just ensure say women will be say most of these things matter. Like we talk. Make no woman supposed to lose her life by or to say she won't bring another life. She won't give birth to another human being. You can't die. It don't make sense. And the data now don't make any sense. So that's why most time we focus on women. Because if women are big give feedback, when she go out, she go tell her husband, she go tell her daughter, she go tell her son, she go tell everybody. Because women, they wired. When women they think for the entire family. So anybody can, if you provide feedback, anybody if you talk anything. And so somebody asked, say, what give me the guarantee? Say a worker not to discriminate against me when I complain. Okay, even if no, we talk and say facilities, no, they do like that. Okay, so that's why when you want to provide feedback, if you think say they feel target you, then you go click anonymous. Anonymous say, I don't want to make my name show. Shikena. So if you tell one of our team members that make them guide you. And then lastly, because of time, do we have to keep leaving feedback to make sure they treat us well? So the thing I say, if you don't talk, if you don't complain, they don't do things well, tell them say they don't do well. Then another day, if you come and say, when I see they do well, you know bad now. Make them know forget, say, these people know they watch again, so make we do anyhow. So continue to provide feedback anytime when you visit the facility. Make them know, say, you safe if they bother you. Over.
Thank you so much, Solomon. Thank you. I think you could assist us in responding to the rest of the questions in the chat as we move over to the poll quiz. So this is the post quiz. You did the pre-quiz at the beginning of the session. Now we would just like to test how much information you have gained. What did you understand? What did you learn today? So we will be launching the quiz now, the post quiz. It's the same questions. We just want to know how much you have learned from this session. You should see them up on your screen now. If you're having any issues, please let us know and we shall assist you. If they are not appearing on your screen, just please click on the 3 dots and then press on polls and quizzes and it should appear. So just 8 easy questions, the same questions that you had answered at the start of the session. We just want to know, what have you learned today? We are seeing the answers come in. Very quick, very easy questions. We will go over the answers as well, just in case you're not sure where this is a non-discrimination chat. So you can drop any answers. No answer is wrong, no answer is correct. We just want to know how much you learned. Please keep the answers coming in. Let us know if you are having any difficulty. There we go. We're having answers come in now. Thank you, team. Thank you. Thank you. Thank you so much. We are receiving answers. We will just spend a couple of minutes on this to receive the answers. Thank you. We are receiving your answers. We just want to know how much knowledge you have gained. We just want to know how much knowledge you have gained. We are also dropping the post quiz on the YouTube. So for those who are joining on YouTube, please see the link on YouTube and also attempt the quiz. Please also confirm that those that are in Lagos and Ekiti are also taking the post quiz. Thank you, thank you. We are receiving your answers. We are receiving your answers. So if you are unable to see the poll quizzes, please click the three dots at the bottom of your screen to your right-hand side and click on polls and quizzes. And this, it should appear once you do that, and then you can attempt the post quiz. Just a few more minutes. We encourage everyone to take this quiz. We do encourage everyone to take the quiz. Let's keep the answers coming in. Let's keep the answers coming in. Thank you, thank you. If you are having any difficulties, please do let us know. Just a confirmation from our colleagues on ground. Are the members able to take the quiz? Are you taking the post quiz on ground? Thank you so much. Just received a message in the chat. Thank you for your answers. We'll just take a few more minutes for the quiz. We just want to know how much you learned today. What information did you grasp? Thank you so much. Thank you. Let's keep the questions coming. Let's keep the answers coming in. Thank you, everyone. Thank you. Thank you, everyone. Yes, Mara, indeed, what an informative and interesting session. Just to reiterate and just to reference what he said, it is important that we as women and as patients who visit these facilities to always drop our experiences, because this helps facilities get better in terms of creating change ideas, in terms of creating plans for plans to assist the quality of care that they give to you. Thank you so much. Thank you. Please do keep the answers coming in. Just a few more minutes. I think we'll just give 3 more minutes for this. 3 more minutes. If you are experiencing any challenges, please let us know so we can assist you. Thank you so much. Just a few more minutes. Please do try to attempt these questions. We believe they're not so hard. It is based on the information that was discussed in the session. We encourage everyone to take the post quiz. Thank you. Thank you. Let's keep the questions coming, the answers coming in. A few more minutes. We just want to know what you gained from the session today. Thank you, everyone. Thank you. We are seeing your answers coming in. So 3 more minutes for everybody to be able to answer these questions. We'd just like a few more people to answer the questions. Keep your answers coming in. We appreciate it. Please keep your answers coming in. Thank you. Just 3 more minutes and then we'll be closing the poll. If you're having any difficulties, please do let us know. We shall assist you. Thank you. Thank you. Let's keep the answers coming in. We are seeing them. Percentage is increasing, but we'd just like more people to drop their answers. Two more minutes, and then we'll be closing the poll. 2 more minutes. Please, let's keep your answers coming in. Thank you to everyone who has answered so far. Maybe just indicate in the chat if you have completed the survey, the quiz. Thank you everyone who has already completed it. We will be doing the answers right after this, just to see those who got them right and those who didn't. But thank you so much for those who have dropped the answers so far. 1 more minute. 1 more minute to go. And we shall be wrapping up the quiz. Just 8 short questions, multiple choice, based off of the information that you received from our wonderful speaker, Solomon, today. We just want to know how much knowledge gain you received today. Thank you so much. Okay. I think we'll start doing a countdown. Just a few more seconds. If you are wrapping up your final questions, we encourage you to quickly go through it. We'll be closing in a few seconds. Thank you to everyone who has already completed the quiz. Just a few more seconds. Just a few more seconds. Just a few more seconds, and then we'll be closing the quiz. Thank you to everyone who has completed the survey. If you're on your last question, we encourage you to finish as we are closing the poll. Thank you for everyone who attempted the quiz. We'll be closing the quiz now, and we are moving on to the next aspect of this, which will be the responses of the questions. So just for the sake of time, I'll hand it over to Solomon, who will be reading through the questions and just giving us the correct answer. Thank you, Solomon.
Okay, thank you so much, Astrada, joining us from South Africa. Maybe you need to learn our Nigerian pidgin. It will help you well. But thank you so much.
I did try small.
You did try small. You really did try. Thank you. And a special thank you to everyone we don't do up to this time. Okay, very quickly. The questions will be asked like we talk. There's no right or wrong answer. The idea that make all of us for learn. So the first question will say, which of the following best describes agency in the context of women's health? Remember, we say agency now. When you, as a woman, as a person, you get the ability, you feel make your decision without anybody influencing you. Nobody to tell you what you do. You feel make your own decision, choose where you want to go receive care, choose how you want to take, communicate, and all of that. So the answer might be a woman's ability to make informed choices and act independently in her own interest, leading to greater control over health. So when you feel talk, waiting in your mind, it will be easier for you to do things with favor you tell the healthcare worker how they do it, so you will piece it changes. The second question saying, according to WHO, World Health Organization, what percentage of the global health workforce is female? We talk and say 70%. Many people forget this one. 70%. The only problem I say, even for that 70%, only very few are in the they position will be saying at them they control things. Hopefully some of those things soon change. Then the next question I say, in Nigeria, what proportion of women aged 15 to 49 report having little or no decision-making power on healthcare use? The correct answer na C, 47%, and it plenty. We hope say after this particular session, many people now go know say they get high decision-making power. So they don't understand say a lot of power there on their hands. Because women say we know they do. Everybody know go do. So very, very important. Then the next one say using a digital feedback tool like NaviHealth. Not say everybody don't hear NaviHealth. If you even go ask the next person what you see. Why you go ask me to give feedback or you don't hear about NaviHealth if they never hear? Explain and give them. So using a digital feedback tool like NaviHealth AI, which complaints do you think patients report most frequently? The answer, that timeliness. Everybody they complain about time. And as I explain, I did the complaint, say people they talk. I come 3 hours, I come 2 hours, time, which is normal. Okay. And like you see now for the healthcare workers we join, when I don't see how another facility like Kona, okay, and now primary health center, how they take manage that time. So you feel take 2 appointments. So don't be say I will come out my house by 7 o'clock and by 4 I still be facility waiting happen. Okay, timeliness. It don't mean say they know they complain about poor communication. Or it don't mean say they know they complain, say they know they treat them well, lack of patience and that care. okay, or say the cost of things high, but the one way for they talk about now time. So if now is when I don't see some of the advice, so if you healthcare facility where we say time an issue, if you also give them if they know they do and let's say another facility do appointment, make una fit try appointment. So only people will be saying their name like A to F will come by 8 to 9, then the other one will come by 9 to 10, not that kind of thing. Everybody will be happy. Then the next question say, what should trigger a feedback from a woman on the quality of care received at a facility? Meaning, waiting to make woman want talk her mind or talk as they do. And almost everybody, 96% get this particular question. Whenever they experience positive or negative, when she gets an experience where either positive or negative, whether good or bad. Not only when it's bad, you will complain. When it's good, tell them, praise them, make them happy. Because when you don't praise person, their head go big, they will want to do more. Okay? So, and that's what like person ask. And every time, yes, every time talk. Imagine say you do a relationship and your partner know they talk to you every time. You see? So when you talk, it means say you care. Let me say you do the complain, what it mean? I say, you did very interested, you care a lot. That's why you talk. Then number 6, say what is one key barrier at the facility level that limits women's ability to give feedback? Many of them have done different answers, but one key one here now, lack of feedback tools. Meaning lack of, so no way we will talk our mind. You know, the healthcare workers are busy, so they don't get time to come listen. So how else will we take to when I don't learn now? NaviHealth.ai. Very, very important. Okay, very, very. So as you don't hear now, now your responsibility to tell others. And then number 7 say which of the following is not one of the 6 dimensions of quality. Many of them I get this one, and the answer now compassion. You know, follow. So the 6 dimensions of quality: timeliness, safety, effectiveness, patient-centered care, equity, and then privacy and confidentiality. That's the 6 of them with that. So when you want to leave feedback now for NaviHealth, you go see they call it emojis or smiley faces. So if you did very happy, you go see the one with the smile, you go click them. If you did very happy, say with timeliness, you go click that one. If you're not there happy, you go click the one with the person frown face, you go click them. Okay? And then they get one box where you go come type. As they do you for mind, talk up. I see that person ask questions saying, shall we give feedback for my papa, my mama? You fit, but you know what we say, make person way as they do person, and that person they in the best position to talk about as they do in their own words. Okay, anyhow you want to talk about, these people they do well, they do fantastic, fantabulous. All these ones they not try. I come here and stay too long. I better make una help me. Anyhow you talk about. Is very important. I want to make it very important. I say, if the system improve, if our hospitals they do well, it will favor every one of us. It will favor everyone of us. Because you don't know tomorrow whether now your papa or your mama or your brother or your sister or one friend then go visit that same facility. So if you see bad thing, you don't complain, you don't talk about them. You go say, after a while, you don't concern me, you don't affect me, I go another place. How you take this show, say that other place where they go, things no also they bad. No system they perfect for our country. So our own role now to ensure say anything we do to improve the system. And the easiest way if you do that to talk, how you want to talk, NaviHealth.ai. And the last one say, true or false, over 90 countries have citizen feedback mechanisms and most are gender responsive. The answer now false. Many of them not gender responsive. Okay, but this one now, NaviHealth, when the facility they see the result, they go know how many women, how many female. Now, how would they know say out of the 22,000 reviews, over 15,000 come from women? because our dashboard, we don't infuse out with that plenty. The machine will just compute and analyze it. Our facility go understand and clearly. So thank you very much. I hope say I don't feel do justice to the question. Over to you, my sister from South Africa, Australia.
Thank you so much, Solomon. We appreciate that. Thank you. So right now we'll be going into the reaction survey. We just want to know, how did you find the session? Just 5 easy questions on how you felt about the session. Like we discussed today, feedback is key. So if you let us know how you felt about the session, we'll improve and make it better for the next sessions to come. So just 5 easy, straightforward questions. We just want to know, how was this session for you? So we have launched the poll quiz, the same system as before. Just please quickly go through the answers. Let's know how the session was for you. Thank you so much. We are seeing the answers coming in. Thank you for your feedback. Thank you. If you are having issues, once again, click on the 3 dots at the bottom of your screen and click on polls and quizzes, and it should appear on your screen. So we'll just take a good 2 minutes on this. These are just 5 easy questions. We just want to know, how did you find the session today? Thank you so much for your feedback. Thank you. Thank you so much for your feedback. We are seeing the responses coming in. Thank you for your responses. Just under 2 minutes now. Thank you for all the answers. Thank you for all the responses that are coming in. Just 1 more minute and we'll be closing the poll. Thank you for those who have given us their answers. We appreciate the feedback. As we said, feedback is gold. It's very important for change. Thank you so much. Just a few more seconds to go and we'll be closing the poll. Thank you so much for the comment. Yes, it indeed was a wonderful and educative session. Thank you so much for that comment. Yes, we do agree. And we hope that this information helps somebody today and we get to see change. Thank you so much for the answers. Just a few more seconds. Just a few more seconds to go and we'll be closing the poll. Thank you so much for everyone who has dropped their responses. Thank you for your feedback. We will be closing the poll now. Thank you so much. Just a reminder once again to please go and download our complete health app on your app stores, as well as NaviHealth.ai, which we were speaking about today in depth, where you will be able to drop your reviews. The link will be dropped in the chat as well, but it's www.navihealth.ai.com, where you'll be able to see all the facilities, search up and drop your reviews. We also encourage you all to please follow us on our social media pages. We are on Facebook, Instagram, X, which was formerly known as Twitter, YouTube, and LinkedIn. You will be able to be up to date with all our information, everything that is currently happening at MDoc We do appreciate each and every person that has joined this session. Thank you so much for all the comments and the questions that were asked. Thank you so much. And the sources, the deck, the links, and the recording of this session shall be shared to you via your email that you registered to join this session. Thank you everyone for joining. We are just reminding again, please do follow us on our social media pages. We are on X, which is Twitter, YouTube, Facebook, LinkedIn. Thank you so much.